So in my previous video, I talked about the general Western media bias in covering coronavirus cases in Nigeria, in Africa, in Nigeria, and many countries across the continent. You can watch that in the link below. But in this sequel, I want to talk about the interesting reactions to the coronavirus cases in Africa, to the low cases, to the low number of cases and the low number of deaths. An interesting place to start would be the doomsday theories or the doomsday predictions, like United Nations Economic Commission of Africa predicted that 122 million Africans will be infected and 300,000 will die. The World Health Organization predicted that about 190,000 Africans will die. The World Bank predicted a 5.1% shrinking of our economy, our first depression in 25 years, and millions going into poverty. Melinda Gates says she sees dead bodies everywhere, but I can assure you she didn't mean it in a bad way, okay? So these are basically all the doomsday predictions that, they assumed. This is the Sahel region of sub-Saharan Africa. I must warn you, the images here are very graphic. Men, women, babies, children, they've been lying here, and from the pungent smell, you could tell they've been here, for many days now. The local authorities have informed us to keep a safe distance because the cause of death is most likely COVID-19. Over to you, Hala. But the question is, what's going on? Why are Africans not dying? And here are some of the interesting ways they are reacting. France 24, one of French news, one of French frontline journals says that the coronavirus is more like the calm before the storm. It's still on its way. It'd be like the coronavirus we go hit us, still they do press up, it's still they do push up. It has not reached, it's still they come. That kind of situation. That's what France 24 is trying to say. So some group of Western media don't believe we're out of the woods yet. If I have to put it in the words of BBC, they say it's the lull before the surge. That means it's coming. It's not there yet. Another interesting, I've read so many funny takes on why coronavirus has not hit Africa yet. But one interesting one from Euronews.com. Euronews is an European newspaper. This is what they said. They said the most likely answer, this is from Euronews.com, the most likely answer is that the virus simply has not properly taken hold in Africa yet. We are still very much in the early stages of this global pandemic. But the virus will, in all likelihood, eventually take hold. Those dire predictions may well still hold true. And this guy is praying for us to die. I really don't understand. But I have something to say. The virus came when it did come. But guess what? Let me take a country like Ghana. Ghana, instituted a mandatory quarantine. That means anybody coming into the country will be quarantined by the government. The government actually put out hotels where they lodged people for free. So if you come into Ghana, you will stay there for 14 days. And when they declare you fit, before you can go in and join the rest of the country after 14 days, So these are some of the, precautions that was put in place by places like Ghana and places like Rwanda. The second interesting take is that we're not testing enough and, the deaths are not accurately reported. But that's where the problem in taking all African countries, in referring to Africa as a country, that's where the problem is. Because some countries are testing better than the others. South Africa is leading the way in testing. A lot of people have been tested in South Africa. Mauritius is also doing high number of testing. Senegal is testing everybody. Because nobody is even talking about the fact that they developed a $1 testing kit that can give you results in less than 10 minutes. Why is no one talking about that? I've seen a lot of conversations about Africa being hot, and that's the reason why we're not as affected as the rest of the world. I will say that even though the hot temperature may have helped Africa, I would say what helped us even more is that we locked down quickly, we locked down hard, and we locked down fast. The Italian, which is the case zero of Nigeria, was quickly traced His contacts were traced. Everybody who worked with him was quickly isolated. The driver who took him to the hospital was isolated. Everybody acted very quickly, you know. So that's what contributed to, you know, in addition to maybe the weather, but more importantly is the structures that were put on the ground to forestall a huge spread. Another point people are making is that Africa is not interconnected and traveling at a fast pace. And I'm like, what do you guys mean? There are 54 countries in Africa. Africa is not a country. I keep saying this. You know, so are you trying to tell me that all those international airports from South Africa to Rwanda to Ghana to Kenya to Nigeria, you know, there are so many countries in Africa that have international and local airports. So what are you talking about? Do you think we move with donkeys? Don't believe what you see on TV. Okay, but more on that, you know. Even if everyone is not interconnected in Africa, because there are some people who don't have access to travel. Those that traveled are going to come back and infect those that didn't travel if the right structures are not put on the ground. In Lagos and in Abuja, you know, some of the capital and business areas in Nigeria, we had a lot of returnees who came back from the UK, who came back from the US because they were worried about the high rates of infection. Yes, they were actually running away from Western countries to come back home because they felt safer at home. You know, but their presence did not constitute an emergency because they were quickly traced, tracked, and managed. Another popular opinion is that Africa has a very young population and a lack of obesity. What do you mean by that? The lack of obesity part is what's making me laugh. Like, you all really think we're hungry, right? I don't really get it. But I'm sure most of you have heard about the term cytokine storm, whereby your immune system reacts in a sudden way. And this affects everybody, both young and old. I saw a conversation that said that you know, Africa is used to having infectious diseases from HIV to AIDS to tuberculosis. It was a very demeaning conversation, you know, and it was more like, we're used to all of these kind of things, so yeah, we should be able to handle coronavirus easily. My take is, while you're congratulating Taiwan and New Zealand and South Korea, it will cost you nothing to admit that Africa is not doing badly. It will cost you nothing to admit that we're actually doing better than you thought, that we're not as bad as you think, that we're not the animal farm that you guys thought that we were. You know, that we actually, I'm not saying everything is perfect. There are a lot of loopholes. There is a lot of poor leadership. There are some things that are just not right, you know. There are things that can be better. But as at this date, Africa is not doing badly. Tomorrow, we don't know what's going to happen because the numbers are growing every day. Lockdowns are easing and we really don't know what tomorrow holds. You know, we hope things continue at this pace. But what I can say is that right now, as of today, Africa is not doing badly and the world should not be ashamed to admit it. Don't try to water down our success. Just accept it. Yeah? That's it, guys. If you like these kind of conversations, subscribe to my channel, like and share, and I'll see you again next week. I put out videos like this talking about Nigeria, Africa. I give you my hot takes and I discuss, you know, some of the trending topics in the globe. So subscribe and join the family. My name is Chizzy and I'll see you again next week. Bye.